Microalgae is actually considered as a superfood.
Yeah.
So it's a complete food. PPARs can actually preserve the bone marrow. One effect that I really like with PPARs is that it's a perfect chemotherapy, radiation therapy support. Do not be afraid of what the results might turn out to be. Because the results that turns out might be life-saving. You just have to take action. That is the first step. Okay? Do not forget to live your life as well. Okay? Enjoy the things that you have right now. Just have faith. It will come to pass.
All right, guys. Welcome again to Simply Healed by Simply Nature. And today we have one of our favorite doctors, and also one of our most popular doctors, the very capable and also very guapo, Dr. Jansen from 4Leaf Group. So once again, Dr. Jansen, we're so happy to have you on. Our viewers and our patients love you. You always get such a great response. So welcome back.
Hello, Sean. Hello, everyone. Glad to be here.
Yeah, Doc, I see that you are actually back on the front line. You're in your clinic right now? You're in your PPE. I noticed you're in your PPE.
Yeah, I'm on my PPE, so they only allow us to wear this. I'm here at my clinic right now. So far, I'm only entertaining telemedicine consults for now, but there are some walking patients that I have to see as well. So I have to be prepared with my gear.
Well, Doc, and to all our patients out there, despite COVID being the predominant thing, we don't forget that other illnesses are still happening. And today, I think this month is actually we're preparing for Cancer Month. So today's topic is one of the most common topics, common cancers in Philippines, and very important because the heroes of Philippines is the Filipina. Right? We all love our mothers. They are breadwinners for many families. They go overseas to work. So I think this really concerns them. So, but Doc, before we even begin, do men get breast cancer as well?
Yes, very rarely though.
Oh, wow. Okay. So this applies to both men and women. So today our topic is going to be about breast cancer. And Dr. Jansen is going to give us a good overview of breast cancer and more importantly, what causes breast cancer, what are the simple symptoms, what should you do? What should you do when you have breast cancer? And what are some of the protocols that you can do even before you see oncologists and when you're working with oncologists and working with Dr. Jansen, what are the protocols that you can do to help you win? I think I want to start by saying that breast cancer has a very, very good success rate, right? Survival in breast cancer is really good now. You don't really have to panic. We have lots of options available and you will do well, right?
Yes.
All right, Doc, so what is breast cancer?
Well, breast cancer, well, simply put, is just a growing tumor or a growing lump in your breast. So that is the most simplest, that's the simplest explanation for breast cancer.
Wow. How is breast cancer acquired? Most of the time we used to, I think we worry if our family has it. But actually, how are some of the ways that we develop breast cancer?
Well, for cancer in general, there are two ways in which you acquire it. It's acquired DNA mutation. So if it's acquired, then it's based on your environment. So you acquired it when you were old already. So that is essentially acquired. So well, something caused it, no? So that is acquired. The second way in which you acquire breast cancer is through genetic factors. So it's when your parents or your mom or your aunt or your grandparents has or your grandmother has a gene for breast cancer. So that gene is the famous BRCA1, BRCA2 gene. So that's
okay.
if you guys are familiar with Angelina Jolie, Angelina
Yes.
Jolie is actually had a genetic test, and it turns out that she has some mutations in those two genes, BRCA1 and BRCA2. Therefore, she had a prophylactic mastectomy. Prophylactic means
preventive.
preventive. Yes,
Wow.
preventive. So if it's preventive, prophylactic means you remove the breast even before the breast manifests lumps.
Wow. Does that mean
Okay?
that no chance of cancer? I mean, just because your breast is not there, you won't have breast cancer. I thought.
Well, technically speaking, if the surgery was done right, there shouldn't be any breast tissue left
Okay.
in the site. So if there's no breast tissue left in the site, then there should be zero chance for breast cancer.
So women with aunties and mothers or sisters who have breast cancer in their family should really be concerned. Is that a valid statement to make?
Yes, actually,
Okay.
everyone should be concerned. Whether or not you have those genes, you should
Okay.
be concerned. Yes, because well, cancer can be both acquired and genetic, right? So if
Hmm.
it's genetic, then you should be more concerned doubly because one way or another, somewhere, sometime in your lifetime, you will have the cancer. Let's say for us in my family, my grandfather has prostate cancer. My grandmother has breast cancer and endometrial cancer, and my tita has died from breast cancer. So cancer is really very prevalent in their family. So I have one of those cancer genes. So knowing that, well, I should really lower my risk for cancer, my lifetime risk for cancer. I have to do whatever it takes to lower it. But there is really no absolutely zero risk, 0% risk. You can only lower it. Breast cancer is the most common cancer in women worldwide. So we know
Wow.
that.
Wow.
Okay, so back in 2012, so almost a decade ago, almost 1.7 million new cases was diagnosed. So this represents about 25% of all cancers in women. 2 years ago, in 2018, there were over 2 million new cases. Imagine 2 million new cases.
Wow.
When you get diagnosed with breast cancer, you can survive as you take action immediately. In the Philippines, breast cancer accounts for around 16% of all cancer diagnoses. So, and about 30% of cancer cases among women. So that's
Wow.
in the Philippines. So estimates, no, doctors usually estimate that 3 out of 100 women will
Wow.
develop breast cancer in their lifetime. So that's
Wow.
yes, that's well, it may sound
That's
small,
a
like three
higher chance
percent,
than
but
COVID mortality.
yeah, but and 3% may seem small, but if you translate that into the actual population of
We
the
have
Philippines,
100 plus
that is a
million.
huge, yes, that is a huge number. That is a
Wow.
lot of women. The top 10 causes of death, no, in the Philippines, neoplasms is number two.
Wow.
Okay? Neoplasm, so that is cancer. So cancer has been number two since 2013.
Wow.
Just
Wow.
imagine.
And by that number, if you're working in a call center, you easily have more than 100 women on a single floor. That means just among your colleagues, three of you will have breast cancer in your lifetime. So those are
Yes.
that's like almost every office floor there are three breast cancer patients.
Yeah,
Wow, that
and
that is quite a
yeah,
lot.
and
Perhaps you can share your advice, what they can do to minimize their risk for breast cancer based on their age group. If they're young, they're middle age, and elderly, are there different things that they can do?
well, of course, depending on age group, there are a lot of things that you can and cannot do. No,
Okay.
but in general, number one is nutrition.
I really wanted to say that it's quite difficult, honestly, to go totally plant-based. If there is a first target to aim for, because I read in one of the studies called the China study, they said that if your meat intake is when it crosses the 20% of your diet, the bad effects get 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 worse dramatically. So
Yes,
would it be okay? Would it be a good first step for most of our viewers, especially the young ones who are healthy? Perhaps a realistic target first is to make sure that on your plate only 20% is meat and the rest is plant-based. Would that be a good start?
absolutely. Yes,
Great.
absolutely. That is a very good start because realistically speaking, our culture, the Filipino culture, is not really very what you call this plant-based friendly.
Yeah, it's
Yeah,
hard to
it's
find
not.
actually.
It's hard. Yeah, it's difficult to find unless you already have made the adjustment. Then it's easy for you to make
Mm,
the what you're already doing. No, but for people who still want to change,
mm,
well, first one is it's a stepwise. It's not really a black and white thing. No? So
mm.
you can actually lower your risk as the animal protein intake goes down.
After dietary, is exercise important?
Yes,
What kind of?
exercise. Yeah, exercise is also equally important than with diet. No, with exercise you lower the risk for recurrence of cancer.
Also, exercise is important to prevent recurrence of cancer.
Yes,
Okay,
yes.
that's good.
So 30 minutes a day of moderate intensity exercise that will do you a long way already. But of
Wow.
course, you should not stop with just 30 minutes. If you can
Yeah,
increase it
can go
to,
further.
if you can do more, then it would be much better. No, so as you age, of course, mobility decreases. Well, for elderly women, still walking is very important. Physical activity is important. If you can do brisk walking, then good. If you cannot do brisk walking, then go for light walks. When you suspect that you have breast cancer, no, that is when you during your bath, when you feel your breast, you feel some lumps, or there are some skin changes in your breast. Some skin changes are when there's dimpling of the skin, or there is a wound there that is not healing, or
Oh,
you have nipple discharge. So
okay.
those are some signs, and of course, when you feel your kilikili, okay,
Mm.
there are some lumps. So those are signs of breast cancer. When you feel those signs, or when you have those symptoms, you have to immediately go to a doctor because breast cancer is really curable. It would be such a waste if you do nothing and then
Wow.
you later realize that, wait, I already have stage 4 breast cancer and it's too late, where in fact you already felt that lump years before and you did nothing. Yeah.
Doc Johnson, what kind of doctor should you go and see when you have all these lump or?
Okay.
Mm,
Okay. When you feel lump, the
mm.
number one person that you have to go to is see a general surgeon or your primary care doctor. Usually, the surgeon will request for an ultrasound, for a breast ultrasound, breast mammography, just to see what the character of the lump is. If it's malignant, then the surgeon will advise biopsy. I highly suggest you go for the biopsy. This is so that we confirm that it is really cancer. Because there are some cases that the masses looks malignant, but when the biopsy came out, it was benign.
All right. Okay.
Okay, now assuming that the biopsy came out and it turns out to be malignant, the next step would be surgery, chemotherapy, radiation therapy. So that's the conventional therapy. And
Mm.
then, while you are preparing to do that or doing that, you have to go to a lifestyle medicine doctor.
Like yourself.
Yes. Okay, so this is not bias, no. It's just that with the knowledge that I have acquired
Yeah.
on this, it's just that cancer is a game of risks. So yes, you went for conventional therapy. Conventional therapy can do a lot of things to remove and really remove that tumor.
Yes.
Okay, but what conventional therapy cannot do is recurrence. You cannot take, okay, there are conventional therapies can have some pills that you can take for a certain number of years that can really suppress your hormones to a very low amount, but then those pills also have side effects.
Mm.
So if you ask me, will it be sustainable? No, because sometime in your life those pills will produce some side effects which you will need another pill to take care of. Okay, so it's better to do lifestyle changes, where in the first place it was the lifestyle factors that you had that caused
That created the cancer.
that
That
created
bad
the cancer.
habit.
So address the go to a lifestyle medicine doctor and talk to the lifestyle medicine doctor how you can change your lifestyle so you get the lowest risk possible.
I've met many breast cancer survivor stories. Most of them have gone for surgery, and then after surgery, they actually do preventive chemotherapy to wipe out whatever remaining, and they are declared cancer free. But so many of them actually the breast cancer. It comes back metastasized. When I talked to the lady who she was wearing a scarf because she was undergoing chemotherapy again, and she was quite sad. She tried to have a positive attitude, but she was quite sad, and she asked me, uh, Mr. Shen, what did I do wrong? And I looked at her honestly and I said to her, I don't think you did anything wrong. I think you went for all the right protocols. You had a surgery, and in fact, your doctors certified you clear, right? And you were clear for more than a year. I think the question is you did not do enough to keep the cancer away after you defeated it the first time. So defeating breast cancer the first time, I think many doctors are confident, but to keep it away, that's a totally different challenge. If you feel some lumps in your body, don't wait, because Dr. Jansen just shared. You know, I know you might be worried. Oh no, I might have cancer, but here's the exciting part, and it'll be so sayang if you delay. You can actually have 100% chance of defeating breast cancer, especially the first time. So the moment you feel any lumps, just go. Don't need to worry, because if it is, you at least you can cure it 100%, right? If it isn't, great. You have a peace of mind. Hallelujah. Dr. Johnson, let's really dive into this topic of the recurrence. So what are some of the things that, since we know that we can defeat quite confidently, if we detect early, quite confidently defeat breast cancer the first time round, what are the things that we need to do to ensure that we will not have a recurrence?
So number one, eat plant-based, because by eating plant-based, then you flood your body with a lot of antioxidants, a lot of phytonutrients. That's how you can combat free radicals, which then damages the DNA, which causes the mutation. Then you address the root cause of cancer. Another one is the sedentary lifestyle. So if you are sedentary, well, your risk for breast cancer is still high. So if you become more physically active, then you lower that risk. How do you be more physically active if you have a sedentary lifestyle and you are so busy in your office? Then just be mindful of not sitting for too long. Prolonged sitting is what's killing people. Okay, so some say sitting is the new smoking. So you have to keep that in mind. So one technique that I use personally is I drink a lot of water. So then I go to the restroom more often. So I stand up, and then if I drink a lot of water, then I go to the water dispenser more often as well. So that's how I do it. And when I talk to patients or when I do have some calls, I usually stand up. If you are smoking, if you are drinking alcohol, please stop. It's a waste of money, and then you are also killing yourself. Okay?
All right.
Do find some other ways on how to relieve stress. There are a lot of ways. Studies have shown that 7 to 8 hours of sleep each night is the most optimal one to reduce your risk for breast cancer. And it's not just the duration of sleep; it's the timing as well. You have to sleep at night, not during the day.
Wow.
So if you are a call center agent that is working night shifts, well, if you are not yet diagnosed with cancer, you have to do all the other stuff that to lower your risk. But if you have that power, if you have that choice, or if you are already diagnosed with breast cancer, you have to take into consideration a career shift.
That's why it's so important for you to have a lifestyle doctor the moment you know that you have breast cancer. Because you got to start this journey even as you're going for chemotherapy. In fact, doing a lifestyle change, changing your diet, getting your body prepared will help you go through chemotherapy better. So Dr. Jansen and all the lifestyle doctors will be able to help you build up your body, correct the foods, your lifestyle that is in epigenetics. That means triggering your genes. So they will make sure that your lifestyle will be friendly to you and hostile to cancer, right? Yeah. And most importantly, Dr. Johnson and lifestyle doctors will help you protect your immune system while you're going through chemotherapy. Because while you're going through chemotherapy, it will destroy your bone marrow, your pancreas, everything will be hurt. So your immune system will be weak. So the Dr. Jansen will have protocols that he will share with you when you meet him, where he will show you how to build and protect your immune system. And that's the reason why people have recurrence. Because after the first fight and they beat cancer the first time, their immune system was also hurt in the process. And that allowed the cancer to come back the second time. So if you are able to preserve your immune system while you're going through your first treatment, and after the first treatment of cancer where you defeated the cancer, if your immune system is intact and strong, your chances of having a recurrence just drops dramatically. So I know that from our normal daily diets, it's going to be hard to take in the lifestyle food that will protect us from chemo and to also strengthen our immune system. So what are the most important few vitamins and minerals and supplements that a patient needs if they have?
Okay, so number one is if you are going on a plant-based diet, no. So this means that you're not eating any animal food products already. Then vitamin B12 is very important. 50 micrograms once a day or 2,000 micrograms once a week. If you're already 65 years old and up, then take 1,000 micrograms a day. Okay, wow. So that's number one, vitamin B12.
All right.
Then number two is, of course, sunlight is very important. But of course, when your lifestyle is really not out there in the open, you have less of a few sunlight exposure, then you can take vitamin D3. Vitamin D3, 2,000 international units once a day. That's already okay. And then some patients, when you are already diagnosed with cancer, no, you can also take vitamin C plus zinc. This is to boost your immune system or to keep your immune system at optimal levels, or one capsule twice a day. Yeah, after meals, no. And then the third one is PPARs. Actually, microalgae. Microalgae is actually considered as a superfood.
Yeah.
It has already been studied by, it's a complete food. It has a complete nutrient, so you won't miss anything. It also has omega-3s, and then its effect is primarily on the metabolism, on your metabolism. So you metabolize fatty acids much faster or easier. So in that way, well, cancer, too much fatty acids kasi in our body produces oxidative stress as well. And it produces inflammation. Typically, patients with breast cancer are on the high or on the heavier weight category.
Oh, okay.
They tend to have more fat inside their body. So this is one way to metabolize those fats. And then, of course, since PPARs or the microalgae is also a food, it has really very low in calories, but it gives you the proper nutrients that you need. It will also help you lose weight. But of course, you have to do your responsibility as well. One effect that I really like with PPARs is that it's a perfect chemotherapy, radiation therapy support. Because chemotherapy and radiation therapy, yes, it will obliterate cancer cells, whatever cancer cells in your body has, but it also obliterates the healthy cells, particularly the bone marrow. The bone marrow is where your immune cells are incubating. It is where they are maturing. So that when they mature, they get released into the blood. If you destroy that nursery, so to speak, you destroy your chance of developing soldiers. So your immune system. So PPARs can actually preserve the bone marrow.
Wow. So that sounds like that's the perfect way to go through your chemo so that there will be no reoccurrence. What a perfect combination, Dr. Jansen.
Yeah. It's really a good combination. Yeah.
Thank you for your illumination. Even I feel encouraged today, and I'm a guy. Dr. Jansen just shared so clearly that number one, there's so many women out there who get breast cancer every year. In fact, 30% of cancer by women in Philippines are breast cancer. So if you have it, you're not alone. The good thing about so many people having breast cancer is that the doctors have lots of experience with breast cancer. And
Yes.
so much experience has gone in that defeating breast cancer the first time, if you detect it early, is almost 100%. That's good news. I mean, if you're stage one breast cancer, you can be confident that you can be treated well. So our takeaway today is don't ignore any lumps, right? The moment you get lumps, don't be afraid. Don't be afraid, because if breast cancer is detected early, it is treatable. Hallelujah. You don't have to worry. Right? And look, our Dr. Jansen is so friendly, so knowledgeable. So if you or any of your loved ones has breast cancer or fear of breast cancer, um, do the steps, right? Get it tested. If it is breast cancer, again, don't worry. Dr. Jansen already said the treatment is going to be effective. Okay, get yourself a good oncologist like Dr. Jimmy, and who will definitely work very well with Dr. Jansen, and you will have a successful first fight and last fight, because there won't be any reoccurrence. Right? If you follow Dr. Jansen, especially after your treatment, your chemotherapy and everything, you won't have a reoccurrence. All right. Any last words? Any advice, encouraging words, or words of assurance you want to tell our viewers out there who have or have a loved one with breast cancer?
Number one is don't panic. Just be composed. Yes. It will. It's normal to feel afraid, and it's okay. It's okay to feel bad. Okay, so it's a natural reaction. But do not panic. The next step that you have to do is go see a doctor, so you will be guided. The thing is that you have to take action. Do not be afraid of what the results might turn out to be,
Mm,
because
great
the
advice.
results that turns out might be life-saving.
Wow,
Okay?
what a powerful
Might be life-saving, because I have a lot of no, these are family members who did nothing because they were afraid of what the results might turn out to be, and sadly, it was a waste, because would have been they would have been treated. They would have been
It would
still
have survived.
living now. Yes,
Yeah.
they would have still be living now. But then they did nothing. So well, what happened already happened. But nevertheless, it's something that we can learn from. Try to also ask questions with all other with some people that might have similar cases. Try to ask them what their experiences are, so you get to learn from them. Don't be afraid to confront your predicament right now. But just have faith; it will come to pass. You just have to take action. That is the first step. Okay.
I,
So
I like
another one is just try to be positive. No, of course we only have a limited amount of time here in this world. So if you keep on be depressed, right? It would also be a waste, because there's, even with cancer, there's still a lot of things in life that you can be enjoying, even with this pandemic. Yeah, even with this pandemic, there is still a lot of life. There's still a lot of things in life to be grateful for. Okay, so
wow,
find those things, count your blessings. Okay,
wow,
so even if yes, you were diagnosed with cancer, or you are suspecting that you have cancer, yes, it seems that all the burden of the world is on your shoulders right now. You are a single mom, you're providing for a lot of for your children who are still very young, and you're the breadwinner, and you were diagnosed with cancer. Even if the burden is too much, try to count your blessings. It will really lift a lot from your shoulders, because then you will be more positive in approaching life. If you are diagnosed with cancer right now, for the next few months or the next few years, it would be all cancer, 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 cancer. Do not forget to live your life as well. Okay? Enjoy the things that you have right now.
wow. What wonderful, encouraging closing statements. I really like the one that to take action. Take action. Because today, breast cancer is something you can treat well. And today we discuss a new angle many of you probably never heard before, which is prevent the reoccurrence of breast cancer. Because many doctors are confident to defeat cancer the first time. All right, it's the recurrence that we've got to stop. And Dr. Jansen shared the strategies. So thank you very much, Dr. Jansen. Again, if you feel lumps or anything, Dr. Jansen is not only a lifestyle medicine doctor, he's also a family doctor. So he can also be that first step, right, Doc?
Yeah, I
Yeah,
can.
you can
I
go
also
and
work in primary care. Yeah.
yeah, he also works in primary care. So he can be the first step to also
Mhm.
refer you to any good general surgeons if you need to. All right. So thank you very much, Dr. Jansen.
Yeah, thank you for having me.
Okay, we look forward to having you again and again and again.
Yeah, yeah, sure.
Bye-bye.
Bye.
All right, you heard it straight from Dr. Johnson. The things that you need to do if you have breast cancer or you're afraid of having breast cancer. Go and see your family doctor and then go through that process. All right, Dr. Johnson's advice is just take action. Don't be afraid, take action. So encouraging. Almost 100% confidence that breast cancer caught in the early stages can be treated. Right now, we want to talk about once you are treating breast cancer, we are pretty confident, doctors are confident, your oncologists will be confident to defeat the breast cancer the first time round. What's important is how do you prevent breast cancer from coming back? Most deaths from breast cancer are not from the initial breast cancer. It's always from the second or third bout of breast cancer. So Dr. Jansen has shared already specifically, you got to protect yourself, your immune system, while it's undergoing all the chemotherapy, radiation therapy, because Dr. Jansen clearly illustrated that the bone marrow is the nursery. You know, nursery is like where you grow your young plants, right? It's the nursery for your immune system. It's where your immune system matures, becomes strong, and is released into your body to fight cancer cells. So you got to protect this nursery during the entire chemotherapy, radiation therapy, and you got to make sure that your nursery is really strong after your fight with cancer, so that you can keep that cancer away and you'll never get a recurrence. Well, Simply Nature PPARs, especially our extracts, have been tested. We have tested our products against chemotherapy drugs, oxaliplatin, cisplatin, and guess what? The published research shows that we protect the bone marrow from chemotherapy drug damage. That means you can go through your chemotherapy and radiation therapy and know that your bone marrow is protected and stays intact. That means once your cancer is defeated, your bone marrow is strong and ready to release your immune system to keep you cancer-free. So if you need to find out more about our Simply Nature PPAR extracts, just drop us a message on Facebook Messenger and someone will be able to assist you. If you want to have an appointment with Dr. Jansen to ask more and to consult him, or perhaps you are one of those listeners today who has a lump but not sure what to do, and you just want to quickly arrange a meeting with a doctor, well, Dr. Jansen is very familiar with cancer patients. He has dealt with many cancer patients, and he's also familiar on how to protect you throughout your entire treatment of cancer. So just drop us a note on Facebook Messenger and we'll be there to assist you. So wishing everybody a healthy week ahead. Bye-bye.